My name is Kristen Nessenson, and I am the Director of Community Relations and Fundraising for the Histiocytosis Association. Before I introduce your host for today's webinar, Beyond the Office Visit, the Cost of Histio Care, I would like to go over briefly just a few important housekeeping items. So today's meeting is, the presentation is for informational purposes only. So any information during these presentations should be discussed with your care team to determine if it applies to your specific situation. There will be an opportunity for questions after the presentation. We encourage you to ask them, and due to time constraints, we may not be able to get to all of them, but we will follow up with email, as we are able to. The webinar is also being recorded, and we will share that recording with all attendees in a follow-up email in the coming days. As I mentioned, there will be time for questions after the presentations. You'll use the Q&A feature in the webinar panel just below to type your question and then read others. If there is a similar question to yours, you can hit the like button. That'll upvote the question so the panelists will know the most popular questions first. There's also a chat feature. The chat feature is going to be used if you have questions, to answer any questions that the speakers may pose to you or to address any technical issues. In a few minutes, we'll add a Zoom help article to the chat window, just in case you need some help, or you can message Histiocytosis Association or reach out by email at outreach@histio.org. Before I introduce the host for today's webinar, let's go ahead and try out the chat feature. That way we can see where you're all joining us from today. So it looks like we have, okay, well, we'll help you with those troubleshooting issues in a moment, but thanks for joining us. We have Ohio, Michigan, Minnesota. So good afternoon and good morning from wherever you're joining us from. So now it is my pleasure to introduce today's speaker, today's co-host, Jessica Corcoran, the Executive Director for the Erdheim-chester Disease Global Alliance, and Deanna Fournier, Executive Director of the Histiocytosis Association.
Thank you, Kristen. We're very happy to have everyone here today, and especially happy about the speakers that are going to help us kick off the series we're very excited about. I'm the Director of the ECD Global Alliance. We specialize in and focus on Erdheim-chester disease research and education and awareness specifically. And we partner with the Histio Association to bring you educational webinars like this one. So we're very happy to have you here, and we hope you get a lot out of the meeting. Just let us know if you need anything after. I'll pass it over to Deanna.
Thank you, Jessie, and thank you, Kristen. My name is Deanna, and I'm with the Histiocytosis Association, and we are dedicated to supporting the histio community and all histiocytic disorders, and we're thrilled for our partnership with the ECD Global Alliance to offer education series like the one today. And same, if you need anything from us throughout the webinar, just feel free to give us a chat or enter your questions into the Q&A. All right, well, I'm very excited to welcome you today to part one of our Beyond the Office Visit series, designed to take you beyond the disease-specific information and to dive deeper into different topics. Today's focus is managing the cost of histio care. And our speakers for today are Victoria Lassen, social worker at Memorial Sloan Kettering Cancer Center in New York, and DeAndre Pate from Health Informatics of Memorial Sloan Kettering Cancer Center. And DeAndre, I'm going to turn it over to you to kick us off. Thank you both so much for joining us today.
Awesome. Thank you, Deanna. Thank you all for having us. I'm happy to be here. All right, so we're just gonna dive into some helpful information that we hope will be beneficial to you guys. And as said, we'll take questions at the end. So very excited. So just an overview of what we'll be covering today. We'll be discussing your insurance. Basically, there's some insurance terms that you guys should know. We'll dive into Medicare and Medicaid specifically. We'll get into disability and FMLA as well. And then, sprinkled throughout the presentation, we do have some resources here that can be helpful to you guys if you have additional questions. All right, so understanding your insurance. So you may have, in speaking to your providers or speaking with your insurance company, you may hear these terms thrown around. Some of them may be familiar to you, some of them not. One of the most common terms is in-network. So basically when your insurance is in-network, that just means that your provider that you're seeing, they have a contract with your insurance. They have pre-negotiated rates that they agreed to that the insurance will pay for your services. There's also out-of-network insurance. So this basically just means that your provider doesn't have a contract with your insurance plan. Now, when a lot of patients hear out-of-network, sometimes they get a little bit nervous because they automatically think that they're not going to be able to have services or be seen by their provider. And that's absolutely not true. And I'll get into that very briefly. Another common term is referrals. Referrals are needed for in-network providers, and a referral comes from your primary care physician. It could come in the form of a written note, or it can be an electronic referral. But this is basically just stating that your PCP is giving you permission to go see another provider or another specialist for services. Lastly is authorization. So going back to the out-of-network insurance. So if you do have an out-of-network insurance, again, that doesn't mean that you can't be seen by the provider. What that does mean that you may need an out-of-network authorization in order to be seen by that provider. Sometimes your provider will have a designated person at the hospital or at the provider's office that works on the authorizations for you. But in most cases, your primary care physician will obtain that first initial authorization that you may need for your services. And then going forward, like I said, there's usually a designated person that kind of handles those authorizations going forward. But if not, you may need to consult with your insurance company yourself as the patient to get these authorizations as well. And you can consult your provider for like any additional information that you'll need to get those out-of-network authorizations. So as we all know, there's many insurance companies out there, many insurance plans, and sometimes it's a little bit confusing to kind of differentiate which insurance plan and like what services they provide. So here are some common different types of insurance plans that you may have heard of. The first being a PPO plan, which is probably the most flexible. These are referred to as preferred provider organization, and PPO plans, they have in and out of network benefits. So again, if your provider that you're seeing is considered out of network, if you do have a PPO plan, you'll still be able to be seen by that provider. Just utilizing those out of network benefits, which usually is a little bit more out of pocket. But some insurance plans, the in-network benefits and out-of-network benefits, they are the same, but it just depends on the insurance plan. There's also POS plans. These also have in and out-of-network benefits, and referrals may be needed for these plans. And sorry, just the backdrop for PPO plans, referrals are not needed. Just forgot to mention that. The third type of plan is an EPO plan, exclusive provider organization. These have in-network benefits only, and referrals are not needed for these plans. But always just a good rule of thumb just to check with your insurance company just to confirm and make sure if a referral is needed or not. And then lastly is HMO plans, health maintenance organization. These have in-network benefits only, and they do require referrals from your PCP. So now we'll dive into two of the most common insurance plans, Medicare and Medicaid. So for Medicare, this is for patients or individuals who are 65 and older, individuals of any age who have had kidney failure or long-term kidney disease, and people who are currently disabled and unable to work. Medicaid is a low income plan. This usually is provided to, pregnant women, children under 19, also people who are 65 and older, people who are blind, and people who are disabled, and also people who may need nursing home care. Also, as an individual and as a patient, you may qualify for both Medicare and Medicaid. So again, if you are low income, disabled and cannot work, and you have low income and you're 65 and over. There's also other plans out there as well, such as the Obamacare plans. They go by different names. You may hear them differently. So there's Obamacare, it goes by Affordable Care Act, it goes by exchange plans and also marketplace plans. All of the same thing, and this is for individuals who may not qualify for Medicare and Medicaid plans. You know, individuals who don't work for an employer, they're self-employed and need to purchase an insurance plan. You can look into those marketplace plans as well. You know, for any options that you may need. So diving back into Medicare. So Medicare consists of two parts, Part A and Part B. Part A is going to cover those inpatient services, your home health and your hospice care. Part B is going to cover those outpatient services. So, you know, office visits, any radiology scans that you may need, that's going to be covered by Part B. Part C coverage, or better known as Medicare Advantage plans, those are going to cover both your hospital care, your medical care, and also your prescription benefits. So that's another option that you can look into besides traditional Medicare. In addition to your Medicare Part A and B, you still may need a Part D plan, which covers your prescription benefits. There's many Part D plans out there. You have to make sure that you do your research when you're looking into these plans, because it's important to make sure that, you know, all your medications are covered. So making sure that you have a list and you're able to reference the medications that you're taking to the benefits of that Part D plan that you may pick is very important. And then in addition, there's also supplemental and Medigap insurance. So Medicare Part A and B, that's only going to cover up to 80% of your services, which leaves over 20%, which would fall into patient responsibility. Most patients in this case, they'll pick up a supplemental plan, which will pick up that extra 20% that's left over so that they're fully covered. So that was a lot of information on Medicare, and you may still have questions regarding Medicare, the type of services that they cover, and, you know, even questions about the application process and how to get started. So here we have a couple of resources that you can utilize. First being the Medicare Rights Center, and we provided the phone number. You can call there basically to just get started with the application process and you know, speak with a representative who will be able to answer any questions that you have regarding applying for Medicare and, you know, just the covered services that they provide and things of that sort. Very helpful resource. Also, there's assistance with Part D costs and for the prescription costs. There's a link there that you can utilize as well. There's a lot of great information there in regards to providing assistance for Part D costs for people who may need it. And then also there's a Medicare Savings Program, which provides assistance for both Part A and B premiums. You know, some premiums can be high sometimes, so there definitely are resources out there to help with that. And then lastly, there is the Benefits Coordination and Recovery Center. So coordination of benefits basically refers to if you're a patient and you have more than one insurance, so you may have, you know, traditional Medicare, then you have that supplemental insurance. Sometimes patients have a tertiary insurance. It's just important to establish which insurance is your primary insurance, which insurance is your secondary insurance, and so on. That's just for us so that we know which insurance we're billing for what services and which insurance is going to pick up the rest that the insurance that the primary insurance doesn't cover. So you may be questioning which insurance do I have pharmacy coverage? Is my prescription coverage restricted to a specific pharmacy? If so, where can I find the list of pharmacies? For this, again, every insurance is different and very specific. So in order to verify if you have pharmacy coverage, I would just call the insurance company directly. Usually on the back of most insurance cards, there's a number for member services in which you as the member, you can call and speak with a representative, and they'll be able to give you any information that you need in regards to what pharmacies you can pick up your medication for, what medications are covered under your pharmacy coverage and so on. So also there's prescription assistance that's available. So sometimes when picking up your medication, I know personally it has happened to me in the past, but sometimes you may go pick up a medication and the copay is something that you didn't really expect, or is something that you are not able to really afford at the time. There are copay foundations out there. One good one is goodrx.com. There's a lot of great coupons on there, and different savings options there to help with like a lot of medications, a lot of common medications that we as patients and individuals use. And then also for that specific medication that you may be taking and picking up, you can also refer to the manufacturer as well, because they usually have saving programs as well that can help you save a lot on these medications. So next we'll jump into Medicaid managed long-term care plans, short for MLTC. These insurance plans are paid at a monthly premium to New York Medicaid, and they provide home care and long-term care services to patients who may need it. They decide if Medicaid home care is needed and how many hours you will need to receive. They also approve other long-term care services such as home care, home health aides, visiting nurses, and PT and OT. And if you're a patient, that may require base care for 120 days or longer, this might be a good option for you. So continuing with MLTC plans, again, they cover those home care and community services. And then at that point, your Medicaid is converted to fee for service. So the MLTC plan will cover those home healthcare services, but you still may need those office visits with your provider and scans and things of that sort. Your Medicaid will be switched to straight Medicaid, which basically means there's not another insurance company like managing those benefits. As they're straight Medicaid, and those will pick up your services such as your primary care and specialty care still. So you'll still have coverage for both. So when you call the conflict evaluation center, sorry, I forgot to mention the number was on the last slide, but when you call that number, you'll be connected with an RN evaluator who will schedule a home visit with you to kind of come assess your situation and assess your eligibility. Ability to apply for MLTC is not limited to patients who already have Medicaid. And if the patient will likely qualify for Medicaid without any complex concerns, they will need community care for 120 days or longer. It would be reasonable to forego a trip to HRA and call the conflict evaluation directly. If the patient is found to be eligible for MLTC, they are also Medicaid eligible as well. And this patient will have the opportunity to then apply for Medicaid. So Medicaid also offers a cancer treatment program. So sometimes you may not qualify for Medicaid. You may be ineligible just due to you don't meet the income threshold and other situations. There is a program for cancer treatment specifically. This is extended to patients who have breast cancer, cervical cancer, colorectal, and prostate cancer, and it also extends to patients who have precancerous conditions as well. Applicants will have to go through a screening process and diagnosis by the CDC, and they will have to complete the process through a designated qualified entity, which is authorized by the state's Department of Health to assist with New York's application process. Currently, there are still income restrictions for precancerous conditions. Patients must have income under 250% of the federal poverty level at the time of diagnosis. So an additional question is, what is emergency Medicaid? If I'm over the Medicaid limit, is there any chance I can still apply? So emergency Medicaid is offered to personnel or patients who are otherwise uninsured or an undocumented immigrant and who have been diagnosed with an emergency medical condition. So you must be diagnosed with a medical emergency in order to be considered for emergency Medicaid. The coverage does vary by state. In New York specifically, undocumented immigrants who have received a cancer diagnosis may be able to receive chemotherapy and or radiation treatment. Coverage of prescription drugs is a little bit more tight with emergency Medicaid. There's a specific list of drugs for emergency care. If your provider is suggesting a medication that is not on that list, they do have the option to override and see if they can get it approved. So that if that is the case, just make sure you do consult your provider so that they can follow up to see if they can get an override. To be eligible for emergency Medicaid, you must meet all of the standard Medicaid criteria, including ID and proof of income. And the only difference is that you don't have to prove your citizenship. You can have emergency Medicaid for a total of 15 months, including 12 months after the application approval, and then 3 months prior to the application approval. You can also apply for emergency Medicaid in advance through the New York State of Health by phone or online if you anticipate that you will need emergency help or care. So next we'll just dive into some Medicaid excess income spend down programs. So if you need Medicaid coverage and your income is above the Medicaid guidelines in your state, you may be offered a spend down for age, blind, and disabled individuals who do not meet the eligibility requirements. If you have medical expenses that reduce your usable income, then you may qualify for this plan. Your spend down amount will be different between your income and the Medicaid eligibility limit. Some states require you to submit receipts, just proof of like your income and kind of like your situation, just to further back the need of Medicaid. So the more information that you provide, the more the better. And those individuals from the Medicaid helpline, they'll be able to answer any questions that you have in regards to those documents that you have to provide. Trusts are available in some states to help you become Medicaid eligible. Trusts allow people with disabilities and incomes or assets higher than Medicaid guidelines to place a portion of their income or assets into that trust. Establishment of a trust, it must meet income eligibility for Medicaid and is permitted in New York State. In New York State, this is called a pooled trust, and it usually is managed by a nonprofit. A pooled trust is irrevocable, and it is best to refer to clients to legal assistance for more information in regards to this. And I will pass it to Victoria.
Okay, thank you so much, DeAndre. I realize for most people attending here, you're not from New York. So a lot of the resources that we have here are New York based because we are New York based, but to that, the national hotlines for Medicare, Medicaid, you would be able to see what's being offered in your state. And every state might differ, but with federal programs are the same. So, strongly recommend speaking with your social worker, or if there's a community organization nearby, whether it's a senior center, a Catholic Charities, to be able to talk to someone there about what the resources are so they can guide you for what's available in your city, in your state, and kind of walk you through the process. So, the Consumer Directed Personal Assistance Program, that's a mouthful. It's part of the Medicaid program. So it essentially what it is, you first need a physician's order for those services. So you would talk to your doctor to see if you're eligible. Then you would have a screening with a social worker and a nurse to see again if you are eligible for this assistance. But what you can do is you can choose a family member that's not a spouse to be your caregiver, and that they would be paid as your caregiver. So it gives you flexibility and freedom in choosing who your caregiver is and who would be helping you with home assistance and daily needs. Again, I recommend speaking to your local Medicaid office, to your doctor, to whoever your healthcare team is, to see if this is available to you through Medicaid, and kind of explore what the options are in the application process. If you do decide to apply for it, one national foundation that could be helpful is the Patient Advocate Foundation, and they can help you with the application process and kind of guide you and navigate those resources with you as well. And then next slide. Thank you. So now we're going to talk about FMLA, Family Medical Leave Act. So this is a program, a federal program where covered employees, so you're working at whatever organization, you take unpaid job protective leave. So what that means is for up to 12 weeks, you can take this all at once, or you can take it in increments. You would be able to take that time off to care for a loved one, and you will not be paid for it, but you'll still have your health insurance through your company, and you're guaranteed to have the same job or similar job when you come back from this time off. Who can take FMLA leave? You will have worked 1,250 hours during the 12 months prior to the start of leave. You work at a location where the employer has 50 or more employees. And then the eligible leave purposes include, the care for an immediate family member with a serious health condition. And, it's also when the employee themselves is unable to work because of a serious health condition. Again, recommend, can we do the next slide, please? Recommend speaking with your human resources department first to see what your options are. You want to understand the process, and we always typically refer to HR. You want to see what the process is, and also kind of talk through the next steps. You get the forms and applications, and that form would be completed by you and also your healthcare team and medical provider. It can be updated and recertified as needed, especially if you're not doing those 12 weeks all at once and you want to split it up like 3 weeks at a time or so. Some resources for this include the U.S. Department of Labor and Cancer and Careers as well. They have health coaches available there to help you kind of navigate how to manage a serious health condition or a condition of someone you love while you're working, and kind of give you the resources to navigate that within your state as well. We can do the next slide. Thank you. Another thing that comes up as well, and we'll talk about this with SSD, but knowing your workplace rights. Cancer and Careers could be really helpful with this, but so are legal assistance, clinics, see if your hospital has one. Being able to understand what your rights are in the workplace when you or a loved one have a serious health condition that leaves you unable to work. In New York, it's called the New York Legal Assistance Group, NILAG, but there should be one in every state, and asking your social worker to connect you to one of those pro bono health clinics could be really valuable in kind of doing these applications or appealing them as well. So you have paid family leave versus Family Medical Leave Act. The paid, it's mostly private employers, and it's a much smaller company, whereas FMLA, you're not going to be paid for that time off. The eligibility and the reason for leave, length of leave, really different for both of these things, but that's why we encourage people to speak with their HR to understand the process. And that's the first place you would go to see, how do I start this process? What makes sense for me in terms of my work here, and then connect with the healthcare provider to discuss next steps. And we'll go into the next slide. So disability benefits. There's short-term and long-term disability. Long-term disability can be initiated following short-term disability, or they can both be done alone, but it's where you can receive 50 to 70% of your earnings, your salary, through your employer while you're unable to work. Again, we recommend speaking with your HR department first to see how to initiate it, and kind of the process for being able to do that. And then we'll go to the next slide. Within that, there's also Social Security, and you can apply for these two, whether it's long-term disability through work. You can also apply for SSD or SSI at the same time. The Social Security Administration is where you would go to first apply for these programs. You can do it over the phone or you can do it online. You can start the application process. For the Social Security Administration, their definition of a disability is having an illness or injury that is expected to last at least 12 months or more, or if that condition is terminal. So being able to apply for supplemental security income, it's funded by general fund taxes, and there are income requirements. Again, if you have questions about whether you meet the requirements, you can call the Social Security Administration themselves or go to a local office within your state that would be able to help you navigate that application. Social Security disability is funded through payroll taxes. You're considered insured because you have worked for a number of years and you've paid into that program. Those candidates must be younger than 65 and have earned a number of work credits in order to be able to enroll in SSD. After receiving SSD or SSI for 2 years, you can also become eligible for Medicare, which is another part of that program. Go to the next slide. So you can apply for either or both via the Social Security Administration. The numbers listed there, so is the link. The benefit of applying over the phone or in person is the interview required can then just be done on the spot, whereas if you do it online, you have to schedule your interview for another date. So this comes up a lot. Many times people will apply and they get denied. If the application is denied, and I want to just normalize it because it does happen a lot. If the application is denied, the advice that we generally give is to appeal it rather than reapplying. And that's where legal assistance can be really helpful. So knowing who those legal health clinics are or the pro bono lawyers, in New York, it's NILAG, that would be able to help you through the process of appealing that decision and guide you through the paperwork. And figuring out who that is in your state or in your city, connect with your local social worker, and they would be able to point you to several resources where you can have someone help you navigate this process. So here's some starter kits. The slides will be sent out, but part of it is the fact sheet. It answers most questions about applying for disability benefits and gives instructions for either applying over the phone or online. We have a checklist of the documents and information that will be requested, so that way you have them prepared. And a worksheet to organize the information that you'll need for the interview. You can download these kits online and they're available in both Spanish and English. And again, I keep mentioning social work because I'm a social worker myself, but being able to navigate the resources and know what organizations you can reach out to, where you can get referrals, is part of our role. And being able to connect who that is in your hospital or part of your healthcare team. And if that's not available, again, it's going to local community organizations, whether that is Catholic Charities, whether it's your local Medicaid office, whether it's a senior center, and they can also direct you to various resources in the community as well. Part of our role is we assess for a financial need as well as provide those referrals in the community. And we can address patient issues that may fall outside of the realm of typical patient care. So that's, barriers to treatment, costs that are coming up outside that are affecting your ability to pay for treatment. Having the support of a social worker to navigate this and find resources could be really helpful moving forward. And it's important to know who that is so you can call them if needed. So some additional resources. I know DeAndre mentioned GoodRx. There are discounts and coupons for prescriptions, and you can also compare different pharmacy costs. NeedyMeds.org is another one with assistance prescription costs. I mentioned NILAG before, but again, this is New York based. It is possible to find out where the legal health clinics are in your community and see how they can help you with, workplace rights, appealing SSD decisions, discussing FMLA and what your rights are in those situations, all free of cost, and being able to have that information is empowering so you know which way to move forward as well. Freedom Care and the Patient Advocate Foundation is assistance with the CDPAP, which is, hiring a family member as your caregiver. being able to talk to your local Medicaid office to see if you're eligible for the program, as well as your healthcare team would be the steps for that. Freedom Care and Patient Advocate Foundation can help you with the application process itself. And then we have the Independent Consumer Advocacy Network. Again, this is New York based, but to ask your, community social worker, your hospital social worker, where you can get help accessing long-term care or advocating for a long-term care plan. And then some additional resources that we've mentioned throughout. I think Cancer and Careers is a really great one. We also have American Cancer Society, National Cancer Institute, Cancer Care. And a lot of times with these themselves, you can ask for resources, whether it's in your community and finding out local organizations that can help either with financial assistance, these applications, or just kind of understanding how to navigate your care. And with that, I just want to thank you for your time. And we'll start with questions.
Thank you both very much. I actually learned a lot, so we really appreciate you both being on. And we have one question in the Q&A right now. And I think this will go to you, DeAndre. She's asking about the Medicaid cancer treatment program. Have you seen this become available for Histio or ECD patients?
Unfortunately, no, not at the current moment. So that the cancer treatment program is restricted to those diagnoses that were mentioned. So like the breast, colorectal, they currently only apply to that. So not for the ECG treatment, unfortunately.
Okay, thank you. So we have the Q&A at the bottom of in your toolbar. If you'd like to submit some questions for the speakers, we can get to those.
And I hope you don't mind me jumping in. I see a question from Michael regarding SSD switching to standard Social Security. SSD is a temporary program, so you can receive that assistance for, I believe, a period of 2 years, and then you would have to reapply. And that's part of the program itself. It does require reapplying and like reassessing the need, reassessing where you're at, and being able to talk to the Social Security Administration about it too, to kind of figure out what makes sense for you, whether it's SSD, SSI, that could be really helpful in navigating it as well.
Darcy has a question in the Q&A. She's not sure who the question is for, but there's debate amongst the doctors and the community as to whether Histio is a cancer. What is this experience receiving assistance from these cancer-focused organizations? So have you had to apply for help or care or assistance for a Histio or ECD by using special codes? Is it considered a cancer when you have to work with that?
Yes, and I will say, with a lot of these organizations, you're coming to them because, you are experiencing a serious medical condition. You are experiencing, either disability or you need to navigate the healthcare system, and the assistance can apply, when you reach out to Cancer Care and they provide financial assistance or, various other resources, it can still apply. So I think it's being able to ask, being able to reach out to these foundations, and also being able to educate them as well. I saw in the chat, ECD and LCH are classified as blood cancers according to the World Health Organization. And also, back to the legal health clinic, being able to, work with a lawyer pro bono and knowing what your rights are within any given situation, whether it is any of these foundations, whether it is initiating a certain healthcare plan, which was mentioned before as cancer focused, but also can apply to different precancerous conditions and understanding, what is available to you. So I think pairing up with one of those pro bono legal health clinics, but also just reaching out to Cancer Care or Cancer and Careers and seeing what they have to offer, because it's going to still be applicable.
Thank you, Victoria. So we have a question about the patient advocacy programs. If they have insurance issues, if they can't get through the insurance appeals and things like that, what resources do they look for that?
Yeah, so I mean, specifically like with navigating insurance, like with Medicaid specifically, utilize those contact numbers that we gave, so like the Medicaid help hotline. They'll be able to assist you with you know, any questions specifically related to Medicaid. If you are looking for like Obamacare plans or you know, insurance plans like that, there are advocates out there that you can search in your area that will help you with applying for insurance overall. They'll give you, you know, the resources, you know, for Medicare, Medicare Advantage plans, all of those plans. They'll be able to sit down with you or over the phone to basically go over those plans and let you know which plan covers what benefits and what services they will cover, and they'll be able to cover the out-of-pocket expenses with you as well, just to kind of like make it better for you to make an informed decision about your insurance.
Thank you. And to like jump off from that, I think, you know, speaking with these programs or your local Medicaid office, or, you know, even contacting your hospital's billing department to understand, or insurance department to kind of understand next steps. There are people there who can help you navigate insurance troubles, but also to guide you in the right direction in terms of community organizations that can be of help. You know, in every hospital, you have billing and insurance, and being able to understand where you stand in terms of that and where to go. And then I saw something from Daniel that's really helpful, and again ties into, you know, reaching out to these organizations to see what assistance they do offer. He mentioned the I believe it was Lymphoma and Leukemia Society that offers copay assistance to ECD patients. So again, you know, reaching out to these societies, whether it's cancer care, leukemia and lymphoma, and being able to see what assistance and referrals they have, because it will be applicable. And if they don't have anything, they will guide you in the direction of where you can go next too.
Can you give a guide to help pay for clinical trial immunotherapy prescription costs? They have a cost of $8,000 a month that they need help getting covered with insurance. So who would they focus on within an insurance company for these issues? Can they get is there access there if they don't have a center with someone like you, Victoria, or DeAndre, that can help them? Is there an insurance person that they should be looking for?
Yeah, usually again at the hospital or the provider's office, there usually is a designated individual or department that does assist with all of those insurance questions. If you're having trouble paying some of your out-of-pocket premiums, or just, you know, paying for like your prescription drug coverage, there is a point person that you usually can lean on that will get you in contact with a whole bunch of foundations out there that do assist with this kind of stuff. So I would just say contact you know, the hospital, the billing department, or the insurance department, just to get a list of those resources, and they should definitely be able to help you with any assistance that you may need. Again, and also checking into those programs that you know, the hospital or provider's office may provide for additional assistance as well.
And to jump off that, sorry, Jessie.
Yeah, go ahead.
You know, some clinical trials do offer financial assistance, or, you know, can help with some costs related to treatment, whether it's travel or lodging. You know, being able to connect with someone on the team there, whether it's the nurse or, you know, someone else, to see what the options are. Because one, they can point you in the right direction, but again, some of them do offer financial assistance. It might not help cover the cost of the treatment itself, but like costs related to treatment, whether it's travel, lodging, anything else that's coming up.
Yes, that's exactly what I was going to say. Some clinical trials, and typically a clinical trial will cover the cost of the therapy. So we could maybe talk to you offline and see if there's something there that we can help you find to help you. So we had someone ask if ECD is a cancer. There was a designation a few years ago with the World Health Organization that ECD and LCH are actually classified as blood cancers. So there's another question in the chat, the Q&A. It took them 4.5 years to receive SSADI, and do they need to transfer Medicare after 2 years?
Would double check with the
Yeah, I'm not
Medicare
sure.
hotline, because I'm not sure if it's a requirement, but definitely just calling the National Medicare hotline, but also the Social Security Administration where you are receiving that from. Something in the Q&A regarding someone's son who's currently attending school while undergoing treatment. You know, part of it, again, is reaching out to these foundations and organizations, but also the school itself might have someone there, the advisor, or someone else who might be able to help either with, it could be school costs or like navigating that system itself too. You know, being able to speak to an advisor there to see what other resources are within the school setting that could help might be another resource as well.
If a patient is having trouble, you know, they're not sure where to go in the community and they're not having any luck at the center to find a point person, like a social worker, what do they do if they're just not getting any help? They're not getting a response from that center to help them, assist them. Is there, you know, is there any way, other angle they could play to get more assistance?
And do you mean you're not getting assistance from the healthcare center itself?
Correct. So many of them, I've noticed when we asked this question in the registration, nearly half of them did not have this available to them.
Mm-hmm.
So I just wonder, you know, if they don't have those organizations, those charities, I wonder where a good neutral location to point them to.
You know, part of it, like what comes to mind, and again, this is a New York-based program, but being able to call 311 here, and it's learning what's available citywide and also statewide in your particular state. Here you can call 311, which is a program that's provided by your state where you can call for resources, let them know what's going on, and they would point you to the organizations that would be of help. You know, I think part of it is also looking into, you know, typing in like social workers or like agencies in your area and seeing what's available. More than likely, there's a Catholic Charities available, and there are other agencies where you can turn to, and even if it's not for your specific need, to see what other resources they have available in terms of agencies or referrals. Again, it requires, you know, some research, but, you know, being able to limit it down to, you know, where you're currently living. And again, like social work agency, and that could be a senior center. That could be, you know, a place where people turn to for support, or even, you know, a church or school. There's a social worker there to see what like resources they have available, where they usually direct people to, or if they know someone they can refer you out to. And again, sometimes, you know, your primary care provider, your PCP, also has referrals too about where to go as well, because this comes up. So being able to ask that question too, and if they don't know anyone, can you think of someone where you can direct me to?
So have you seen many patients use attorneys to help with any of these claims or appeals? Is that common?
I often refer to NILAG, again, the New York Legal Assistance Group, to help appeal Social Security or FMLA to discuss that. It is common. I think, you know, a lot of these pro bono agencies have a waiting list. So, you know, being able to know that someone will reach out to you within a designated amount of time. But it is common. That's where I refer to help with that process as well. And they're able to guide you with next steps. And again, knowing your rights.
That sounds like a great resource. You'd like to think every state has that. It's like Deanna mentioned in the chat, the pharmaceutical companies, the manufacturers of the drugs often have the compassion programs that DeAndre covered. And if you're not sure who that is, or if you need help, you can ask your doctor. You can ask either the Histiocytosis Association or the ECD Global Alliance, and we can connect you with the right program as well. We do have resources that we can help you with if you're having trouble, if you didn't find a specific state program that you're looking for. Definitely reach out to us as well, and that's what we're here for as well. So if you have more questions, we actually have, if Kristen, you would like to show our slides, we do have contact information where you can get in touch with each and every one of us, or you can reach out to our support lines for questions concerning your pay and your insurance and your Social Security and whatnot. So we'll continue the series with more information for different areas of managing your care and all of the things that go along with your doctor visits. So we appreciate you both so much, DeAndre and Victoria. This was very, very informative. I can speak for myself, and I'm pretty sure everyone found this to be very helpful. So we really appreciate your time in preparing and giving these presentations. And we hope to have you back.
Thank you.
Yeah.
Thank you so much.
Thank you, everyone, and thank you for the questions as well, and also the resources that you all are providing over the chat.
Thank you, everyone. We'll get a recording out to you within a couple of weeks. You'll have an email from us.